Well, the short answer to that is yes, it is a painful operation. The important thing to remember is that there's lots of things we do to try and help control that pain. Most people, for example, opt to have something called a spinal anaesthetic, which is an injection into your back which helps to numb your legs, similar to an epidural which women have during childbirth. And that's really effective because it means you don't wake up after your operation with severe pain. And the pain sort of creeps in gradually, and we can control that pain with other painkillers, whether they be tablet or in an injectable form. So you don't have a really sort of severe pain all in one go, and that's really important. The pain after the knee replacement does settle with time, and the first couple of weeks are by far the most difficult, and it's important to remember that in the early days after your knee replacement. And by the time you get to 6 to 8 weeks, the pain should be very, very manageable, and you may only be taking the occasional tablet to help if you've overdone it. Some people, unfortunately, do experience pain in their knee replacements for quite a long time afterwards, but that's more the exception than the rule.